We started this project mining data from big genomic analysis in diffuse large B-cell lymphoma and follicular lymphoma, and we came across the finding that we could define quite well which patients were going to relapse earlier and which patients were going to achieve a prolonged remission of the disease. And in particular, in the case of DLBCL, we have tested this algorithm profusely in a lot of databases, and we can confirm its superiority. However, when you deal with other types of lymphoma that are less frequent, you have this problem that is related to the lack of sample size, and you need somehow to try to get some information that you can transfer from other types of lymphoma to these lymphomas and check if that could also be useful to risk stratify patients, because it's very difficult to develop a genomic analysis specifically for rare diseases such as peripheral T-cell lymphoma or mantle cell lymphoma. So we initially took these machine learning gene expression survival predictors that we developed in DLBCL and follicular lymphoma and tested them in data from patients with peripheral T-cell lymphoma and mantle cell lymphoma. I have to admit that these cohorts have some heterogeneity, and in the case of mantle cell lymphoma, it's quite old. So we will need to evaluate their performance in current settings with newer agents such as ibrutinib-based therapies in mantle cell lymphoma. However, the performance was very good. Particularly in the case of mantle cell lymphoma, we achieved concordance indexes of over 0.7, which is very high for just a genomic for just a genomic model. That is the performance of the predictor based on the DLBCL and follicular patients to predict the outcomes of patients with mantle cell lymphoma was very high. And in the case of peripheral T-cell lymphoma, we observed also that these patients were having a very little capacity for risk stratification, so we also reasoned the same, like, can we do some transfer learning, and these machine learning risk predictors that we developed with DLBCL and follicular lymphoma, just taking the same genes identified for these different lymphomas, just try to evaluate if in PTCL they can also be prognostic and enable for a better risk stratification. So again, we discovered that despite being both being very different types of lymphomas, we could be risk stratifying these patients with a concordance index over 0.6, which is quite reasonable and should be complemented with other tools. So exciting results that probably we have the capacity to transfer these genomics tools that we are developing for DLBCL and follicular lymphoma patients to rare types of lymphoma that are nonetheless mostly unmet medical need and need obviously newer therapies and newer ways to risk stratify them.